Welcome to today's webinar, Collective Impact in the Real World, from Common Vision to Collaborative Evaluation. This webinar will focus on evaluation using results-based accountability in a collective impact framework. Collective impact is an innovative and structured approach for organizing community action among multiple partners. My name is Toni Lewis, and I am a community coach with the County Health Rankings and Roadmaps program. I'm joined by my colleague, Erica Burrows-Girardi, a fellow community coach.
Hello, thank you for being here today.
So Erica will be sharing links with more information in the chat box. After today's webinar, you can find those links along with the webinar slides online. Also joining us today is our guest, Dr. Ashley Anglin, coordinator of the Atlantic Center for Population Health Sciences at Atlantic Health System.
Thanks so much, Toni, for inviting me to participate in this webinar, and also a big thank you to everyone who's joined today. I'm really excited to share with you an overview of collective impact as an approach to creating positive change in communities, as well as a framework that can be used to evaluate the impact of collective impact initiatives.
So today's webinar is the third webinar of 3 in our our evaluation webinar series. Erica is chatting out the link to the first and second evaluation webinars that are archived on the County Health Rankings and Roadmaps website. So I'd like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. Next, I want to take a moment to get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of 2 parts. As you can see on the left, it's the viewer window where you see our screen throughout our presentation. And on the right, you can see the control panel. You can interact with us through the control panel by using the questions section. Feel free to ask questions or share your thoughts here via this control panel throughout the webinar today. And we'll be sure to leave time at the end for your questions. Just above the question box, you'll notice the handout section. Erica has placed 2 handouts there to provide you with more information related to today's webinar content. As we move into the real content of today's webinar, we'd like you to consider these questions as you listen. Who else do you need to share this information with, and what is one idea for action you're taking away from this webinar? I want to start by grounding our audience in the County Health Rankings approach. The County Health Rankings ranks the health of nearly every county in every state. This image illustrates why it's important for communities to take a broad definition of health, because many factors like housing condition, access to parks, the quality of our schools, and access to healthy foods, community safety, and our social connectedness all impact our health outcomes. And this image tells us that effective policies and programs can improve a variety of health factors. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment that in turn shape health outcomes, which are measured by the length and quality of life. So how can communities take action? This is our Take Action cycle, which sits in our Roadmaps to Health Action Center, where you'll find numerous resources and tools to support action. If you need any assistance, a community coach could help guide you. During today's webinar, we'll focus on Evaluate Action Step. Looking at the center of the Take Action cycle, you'll see that in order to address health effectively, we need to harness the collective power of people from all across the community. No one organization or sector or group of individuals can do it alone. This multi-sector approach to community health improvement with community members at the center is how we can address the many factors that influence health. Dr. Anglin, our guest speaker, comes to us today thanks to a very special collaboration between New Jersey Health Initiatives, or NJHI, and the County Health Rankings and Roadmaps. Through this collaboration, NJHI has provided coaching and grant funding to 20 communities across New Jersey. Now I'd like to introduce you to Dr. Ashley Anglin, the coordinator of the Atlantic Center for Population Health Sciences at Atlantic Health System. In this role, Ashley provides technical assistance, program design, and evaluation support within Atlantic Health System and across northern New Jersey. Ashley is also the secretary of the North Jersey Health Collaborative and the project director for the Collaborative's New Jersey Health Initiatives grant in Morristown, which is how she and I met. Her aim is to collaborate with community residents and organizations to conduct research and develop interventions that promote holistic well-being. From initiatives that address individual health behaviors to those that generate changes to policy and the built environment. Ashley, could you begin by telling us more about where you're working in the beautiful Garden State?
Absolutely. So my office is located in Morristown, New Jersey, but Atlantic Health System and the North Jersey Health Collaborative cover a broad area across northern New Jersey, and that includes Morris, Passaic, Sussex, Union, and Warren counties. The communities we work in are diverse in population and geography, stretching from rural communities in the northwest corner of the state through suburban areas and into urban communities just across from New York City. And to help ground this information in the real world today, I'll be sharing some stories of the North Jersey Health Collaborative, an independent 501c3 organization comprised of over 150 partner organizations working across this geography.
So before we learn more about the North Jersey Health Collaborative, Ashley, could you tell us about what you see are the basic elements that define collective impact and how it differs from other approaches to addressing community health and well-being?
Sure. So at its core, collective impact is about bringing people together in an organized way with the goal of creating positive social change. So it's about aligning our work with others to maximize impact. The specific goals or focus of the collective impact approach will vary from initiative to initiative, but all collective impact models are really at their core about partnership, connection, and collaboration. But we all know that working together, especially across sectors, geographies, and cultures, it can be difficult. So collaborative impact models aim to bridge these divides and facilitate collaboration through 5 key components. So the first component is the creation of a common agenda. So this includes both coming together to define the issues the group hopes to address, as well as creating specific plans for addressing those issues. Next comes shared measurement, one of the most daunting components for many, but also one of the most important. So without shared measurement, we can't define the impact in collective impact. So having shared measurement means that all partners agree to track progress in the same way, and ideally to use this information for continuous quality improvement. Next is engaging in mutually reinforcing activities. So this is a true hallmark of collective impact models. So collective impact encourages partners to connect existing work, align organizational missions, reduce duplication of efforts, and address gaps and opportunities. So sometimes when we find a gap, we might create a new initiative together, but more than anything, it's making sure that the activities build on and reinforce one another instead of duplicating efforts or competing over resources. Next, a strong backbone is needed to support the work and provide structure and direction. So this means having people who are dedicated to organizing and orchestrating the work. Sometimes it's one organization, sometimes it's a leadership team, but in all cases, collective impact models won't stay standing for long without a strong backbone, pun intended. And finally, continuous communication is what connects all of the other components. So it's how we can create a common vision and then spread the word. It's how we agree on shared measurement and communicate our progress. It's how we create and connect mutually reinforcing activities, and it's how the work is orchestrated and by collaborative leaders or the backbone organization.
Ashley, in your opinion, is collective impact a comprehensive framework for working together?
That's an important question. So as a caveat, while these elements do provide a helpful framework to guide collaborative efforts, and it will definitely help guide our discussion today, I want to mention that there really is no one-size-fits-all model for generating social change. And at face value, this model is missing a key element, community members, and some critical considerations that coalitions should address, such as social and economic injustice and structural racism, shared decision-making and power, integrating community organizing and leadership development, and focusing on policy systems and environmental change.
Right. Well, you mentioned collaboration earlier. I'm wondering, how is collective impact different from collaboration?
Well, regardless of the approach, most of the organizations that I've spoken to or work with, especially community-based organizations, say that they have partners that engage in collaboration. So this is not a new concept by any means. And I do believe that most organizations truly value partnership and collaboration. But we don't often ask what we mean by collaboration. So in some cases, we mean that we share information with other organizations. So we share flyers, we publicize each other's events, we attend common meetings. In other cases, it's about referring people to a different community service or agency. Sometimes we might co-host events or programs. So all of these activities are undoubtedly positive and help to build relationships and connections, but collective impact takes it one step further. So collaboration or partnership alone is generally built around a certain program or initiative. For example, so say my organization wants to implement a heart health program, and I want to do this program in partnership, so I reach out to other organizations in my community and I see who's interested. We implement the program with an underlying intention of really proving whether or not the program works. For my organization, it might be a core effort, but for my partners, they might be doing this work kind of on the side or in addition to their day job. In evaluating our work together, we'll often focus on ideas for how to make the program better next time. Collective impact, on the other hand, really brings people together to move outcomes. So in defining our common agenda, we start with defining the issues that we want to address, long before we start coming up with programs or initiatives or solutions. So our goal is to improve and build upon the work going on in our community, and ideally it becomes or is a core component of each organization's mission. And because we aren't tied to specific programs or initiatives, we're more free to advocate for what works and let go of what doesn't.
It sounds like collective impact is truly a journey.
Absolutely, and you can see that here in this great slide. So even though the components of collective impact may seem straightforward, we know it's a process, we know it's a journey. So look at this meandering path. It starts with the history and culture of the community, with organizations working in isolation. Then, due to champions and need, a group comes together to form a common agenda. And along the path, the backbone organization and structure comes into play, and the group begins to learn together, hitting obstacles along the way, but thanks to shared measurement, mutually reinforcing activities, and continuous communication, you can see that system transformation is on the horizon.
Yeah, thanks so much for a clear illustration of the model of collective impact. Can you give us more of the real-world examples of these components?
Yeah, absolutely. And to do that, I'm going to dive deeper into 3 of the 5 components of collective impact: common agenda, backbone function, and shared measurement, and share examples of what these components look like as undertaken by the North Jersey Health Collaborative. So as we saw on the meandering, exciting journey to systems change, the first step is to come together to collectively define the problem and create a vision to solve that problem. This component may seem clear-cut, but getting multiple parties to agree on both the problem or problems and the plan for addressing these is tricky. And honestly, it's a double-edged sword. So the more partners you have, the greater your potential for impact, but also the greater potential for confusion and conflict. And that's why taking time necessary to address these needs and visions is so important, even if it's not the most exciting, especially for those folks who really want to dig in and get to action right away. And I always think we're in this phase about something my yoga instructor once told me. It's that you have to stop to start. So before jumping into the work or the yoga, we need to slow down, breathe, and set our intentions.
Yeah, that's really helpful. So what does the North Jersey Health Collaborative's common agenda look like?
Well, as I mentioned, the North Jersey Health Collaborative, which I'll refer to as the NJHC from now on, because it's a mouthful, is an independent, self-governed 501c3 organization comprised of over 150 partner organizations from multiple sectors across 5 counties. And the shared vision of the NJHC is to create healthy people, healthy communities by building the capacity of our partner organizations to improve community health. The problems we're trying to address through this shared vision are, first, kind of getting rid of this duplication of efforts. So especially when it comes to needs assessments, where in the past we had multiple plans, multiple priorities in each county, but with little or no coordination of those efforts. The other issue we're trying to address here is that many organizations lack the capacity to substantially impact community health when working in isolation. So our plan to address this problem includes 3 core functions of our collaborative. So the first is really using best practices in community participatory research to coordinate and conduct collaborative health needs assessments and to develop shared action plans. We also work to develop and maintain a community-based population health data portal for shared data resources, more effective communication, and a way to coordinate and monitor the initiatives in our communities, which you can see at njhealthmatters.org. And then third piece is really to develop and implement these collaborative evidence-based strategies for improving population health. It includes program development, grant preparation, and advocacy efforts.
Yeah, when you share these 3 core functions, it really makes me think about the County Health Readiness Roadmap's principle of measuring and sharing progress and results widely and using these results to continuously improve progress towards the journey for improved health.
Mm-hmm.
Given this multi-county collaborative, how do you collaborate on community health needs assessments?
Well, our community health needs assessment, which you can see here, was conducted in each county, and it helped us to further define the health issues that we wanted to work on together. So the process involved first analyzing over 150 health indicators that are available on our website, and you can see that in phase 1. The data committee really put that together and presented it to where we got feedback from and input from stakeholders, which took us to about 150 issues per county, and then from voting down to 12 issues per county. We also did a digging deeper phase to uncover root causes and affected populations or geographies. We then voted again in a transparent process on the issues that we'd like to work on together. And that's really what set us up to that implementation of those collaborative countywide action plans and the continuous evaluation phase that we're really in now. And this work throughout the needs assessment was supported by a regional data committee that's comprised of the data people from multiple different organizations. And while I won't get into detail on each of these sections, I do want to briefly mention the importance of our digging deeper phase. So for the NJHC, this is a really important mechanism for assuring that we are staying true to our aim of addressing health equity and health disparities, and that we are disaggregating the data to design these equitable strategies, an approach discussed by Janae Queen-Nazaire that you see in the article linked in the chat box. So in this stage, we really took the time to consider for each of the issues on the table, their root cause and the populations or geographies that face a disproportionate burden of these issues.
It sounds like NJHC works in multiple ways to assess the needs among different populations and at various locations throughout New Jersey.
Yeah, exactly. And let's take a look here at how that looks in Morris County, one of our counties. So in that county, the needs assessment process generated 4 topic-based priorities that you see here, and 1 neighborhood or geography-based priority area. And that geography-based priority area really emerged from the data and community input, which demonstrated that while the average community in Morris County is relatively healthy and wealthy, there's significant health and socioeconomic disparities that are negatively impacting the lives of community members in certain neighborhoods. And these priority areas from the needs assessment became the components of the common vision for the county work groups that were formed around each priority, who then are working together to develop and implement plans to address those needs. And this example really highlights the point that in many collective impact models, components of the common agenda can exist at multiple levels. So the NJHC has a common organizational vision, but also county-level priorities and work group-level results and impact statements. For example, you can see here the intended result and impact statement of the obesity work group.
Ashley, this brings to mind for me 2 questions. First, how long did it take to come to this common agenda? And second question is, what role did the backbone organization play in setting the agenda?
Well, first, in terms of timing, our first collaborative health needs assessment took about a year, and it really wasn't until that assessment was complete that our work groups were able to form and combine and make their results and impact statements. For the NJHC as a whole, our common vision first came together with the founding of the organization in 2013 and then was revised and revamped as we grew from 9 founding organizations to the much larger partnership that we have today. And like I mentioned, components of the common agenda can exist at multiple levels. The key to it all, however, is making sure that these visions, especially if more than one exists, fit together snugly like a community health puzzle. And that's where that strong backbone comes in. So the NJHC is, all of the activities that I've mentioned here from the NJHC are supported by our organizational backbone. So as we know, a strong backbone means having a dedicated team and structure to coordinate and support the work of the group as a whole. But what are the specific activities that this group must engage in to assure the backbone is strong? So a few key activities include guiding vision and strategy, supporting aligned activities, establishing the shared measurement plan and process, building public will, support, and enthusiasm, advancing policy related to the work, and that might be both organizational and governmental, and mobilizing funding to support the work. Whether this means applying for grants, restructuring budgets, creating funding lines, or other unique funding strategies.
Yeah, in terms of funding, the North Jersey Health Collaborative has been very innovative, I understand. It's funded by its members. Tell us a little bit more about that.
Yeah, that's right. So the NJHC is member governed and member funded. So we have a board of trustees that's comprised of representatives from all of our funding organizations. And this body, along with the executive committee, really guide the vision and strategy of the collaborative, create that organizational policy and build public will, and especially help us to make sure the whole process is transparent. We also have regional committees, including the data committee. And the data committee you'll see here on the slide, that's the group that really guides strategy and provides technical assistance to partner organizations around the needs assessment, data collection, and evaluation. We also have the marketing and communications committee that helps to assure community, we have that continuous internal and external communication going on. And the finance committee, which is being developed to pursue new funding opportunities and mechanisms to support our work. In our model, the backbone you see here, the functions aren't just held within one partner organization, which is the case with some other models, but are instead spread across leadership at multiple levels.
Right. Well, now for the questions many of you on this webinar have asked us in advance. How do we know that this structure works? And how do we know that we're actually making a difference in the health of our communities?
Well, that's where shared measurement comes in. So shared measurement involves all partners agreeing to track progress in the same way and to use this information to continually improve collective efforts. There are many ways to do this, but today I want to jump right to the approach that we're using for the NJHC with the open invitation to all of you to engage in some R&D, some rip off and duplicate. So within the NJHC, we have 5 diverse communities, ranging from rural to almost New York City, over 150 partner organizations, 16 topic and geography-based work groups, like the one you saw for Morris County, and approximately 60 strategies for the health improvement that are being implemented simultaneously by our partner organizations.
Can you tell us more about how NJHC evaluates impact?
Yeah, so we use a specific model, and the model that we've selected for our shared measurement plan is called results-based accountability, developed by Mark Friedman and described in his book, Trying Hard is Not Good Enough. And at the core of the RBA model are 3 simple questions that you see here. How much did we do? How well did we do it? And is anyone better off? And we selected this model because it really gets from talk to action quickly. It's simple, common sense. It's a process that most people can understand just from looking at these questions. It allows us to build collaboration and consensus, and also to measure both process and outcome, which are both keys to really a strong evaluation.
I like these questions. They seem straightforward. Help me understand, where do these questions fit into the evaluation? To whom or what do these questions apply?
So we ask these questions of the specific strategies that we're implementing. So they capture our performance accountability or the well-being of client populations, services, agencies, and systems. It's really what we have direct control over, but our intention is to measure and share data to ensure accountability for both the well-being of people and the performance of programs. And the key here is making sure that what we're tracking for performance accountability is logically and intentionally connected to what we're intending to influence in terms of the population as a whole. So in the case of the NJHC, population accountability is captured in the intended results of each county and the population level indicators that we track on our website. So that's something like, for example, age-adjusted death rate due to diabetes in Passaic County. On the other hand, in performance accountability, that is about the well-being of populations as influenced by the program's agency services or systems. So this is, like I said, what we have direct influence over and really involves our strategies and programs, as well as the performance measures that we use to address the questions, how much do we do, how well do we do it, and is anyone better off?
It is clearer when you differentiate between process and outcome evaluation measures.
Yeah, and our collective impact evaluation, like I said, really involves the tracking of both process and outcomes, and we do it at 4 different levels. And a key to this is making sure that these multiple levels talk together. So we aim to accomplish this by making measures that logically roll up from one level to the next. So what that means is that a specific performance measure makes sense at the work group or on the ground level, but also at the county and regional levels. So all of the pieces and parts should logically connect to one another so that at any given time we know how well we're doing as a county committee and also as the full North Jersey Health Collaborative that covers several counties.
So what do some of these levels look like in a real world example?
Well, I'll share here a little bit about our work groups. So the foundation of the NJHC are those work groups, and there's 16 in the collaborative, and they're the ones that are generating and implementing the strategies that will improve the health of our communities. Together, these 16 work groups are implementing approximately 60 strategies. So that's a lot to capture, and we quickly learned that developing 60 separate program evaluations would be a complete mess and be impossible for anyone to keep up with. We also knew that if the measures only made sense for each strategy, that we wouldn't be able to see really clearly the impact at any other level. We'd be perpetually in the weeds and not seeing the big picture. The aha moment came when we realized that the 60 strategies fit into 9 categories. For example, categories around engaging stakeholders, or environment systems change or advocacy, or participant health information specific to a certain disease, or providing tailored information to targeted groups, or a referral or pathway or connection to services. We were then able to take those categories and make performance measures for each of them using the RBA format. So here you can see the performance measures that go along with the category provide tailored information to targeted groups. You can see the RBA questions: how much do we do, how well do we do it, and is anyone better off? The performance measures are those bullets below each question, so the number of individuals reached, percent in target populations or geographies, etc. And you'll look and see this is a little generic, and that's intentional because these performance measures and questions apply to multiple work groups working on different topic areas. So for example, this category applies to a strategy in 5 different work groups.
Now I want to bring up the issue of equity. Earlier you mentioned the role it played in the needs assessment, but is it also a component of the evaluation?
Yeah, and actually for us, we tend to address equity using the question, how well did we do it? So if equity is a core lens for us, which it is, and we're using it to direct our work, we didn't do the work well if we haven't addressed whether or not we're actually implementing the strategy where we intended, how we intended, and with the population that we are committed to working with. So take the following example. So this is a strategy from one of our work groups, and the strategy is to provide training to community members and landlords in Morristown Census Tract 435 around tenants' rights and landlord responsibilities. And that fits within the category you see here. And you'll see how we use percent and target geography populations as a key measure for the success because we're really focusing at where we saw the greatest need for this particular strategy. In other work groups like this one, we also have strategies that aim specifically to engage and partner with community residents, and we hold one another accountable for the success of those strategies as well. And another incredibly important benefit of this evaluation plan in the straightforward RBA format is that we're able to essentially give the evaluation away to each work group. So it's not just a couple of evaluators doing this for the whole group. Each work group had input on the performance measures for their group, and they're the ones collecting the data and reporting it to the county committees. Really giving the evaluation away and building ownership within our partner organizations greatly increased our ability to do evaluation at this scale.
Then it's the population you're focused on and the level of community involvement in the evaluation which really supports equity.
Absolutely, that's so true. And as we go past that strategy level 2, they're involved as well. So we move there into population accountability at the work group level. And you'll see here on this slide the indicators to the obesity work group in Morris County. Those are at the top there, those dials. Low-income preschool obesity, child and food insecurity rate, and adults who are sedentary. And these indicators are publicly available on our website, and we monitor trends in this data over time. They're logically connected to the strategies this group is undertaking together and to that impact statement you see below. They really are there to give us a bigger picture of how our work contributes to change in these indicators. And then next, one level up at the county level, each of our counties currently have between 3 and 5 work groups that, despite focusing on different topics and populations, are all working to improve the health of people in their county. The logic here is that if we did our needs assessment well, and we really identified the most pressing needs and are doing work, the best work we can to address these needs, that will improve health overall within our counties. So we need to capture this population level focus at the county level too. For this, we use the measures of years of potential life lost and disparities in life expectancy at birth. I won't get into the specifics of these measures here, but the years of potential life lost measure really helps us to see how well we're doing at prevention at the county level, and disparities in life expectancy at birth show us how well we're doing at making health accessible for all. It shows the gap between the healthiest and the least healthy municipalities within each county.
It sounds like the New Jersey Health Collaborative can readily identify its opportunities to improve health at this sub-county level. Ashley, could you tell us a little bit about engagement of the NJHI members in each of the work groups?
Definitely. I mean, that's really the key. So partners engage in our work groups and committees, sometimes more than one, based on their skills and organizational priorities. We've had around 250 active individuals in the past 90 days, And we know this because at the final top level, we track the function and impact of the collaborative as a whole. We keep an engagement scorecard to track participation and engagement by various categories like sector, county, and work group. We also have performance measures based on the RBA format at this level that tie back to our common vision for the collaborative. So for example, in how much do? We track the number of active organizations, website users, and actions completed by our work groups. And how well do we do it? We survey our membership on a regular basis about the value of their participation in the collaborative, their work group capacity. And in terms of is anyone better off, we can look at the dollar equivalent of resources leveraged, the number of people benefiting from our work group strategies, and the reported increased partner capacity for community health improvement. And you'll notice that one ties directly up to what our vision is for the collaborative as a whole.
Wow, that's amazing. And that image really makes it easy to see which sectors are involved in NJHC.
Absolutely, and it's a key to being able to continuously improve our work. Looking at that picture, we can say who's missing. And so really being able to improve our work is based on the data that we collect at multiple levels. And our evaluation is a living thing. It's not meant to sit on a wall or a shelf. We need to be able to be flexible and engage in an iterative and continuous process. For our work groups, it looks like this: collecting data for each of their strategies, reporting their performance measures to their peers in the NJHC leadership, publicly sharing the data on our website to promote transparency, tracking change over time and making adjustments as needed. And throughout the process, the county and regional committees, like the data committee, are there to provide support.
Well, thank you so much for taking us on this in-depth and real-world evaluation of collective impact. In reflecting on the process you described, how, in your opinion, have you seen it work to improve the health of the North Jersey region, but thinking specifically of those that are more impacted by poor health outcomes?
Well, in answering this question, I just want to return back to this slide, and I want to just take a pause for a minute to ask you to really look at the collective impact change process here. So I think looking at this, our biggest strength right now is how we've been able, in many cases, to begin restructuring the system around healthcare, public health, and community-based organizations in our region. We've really seen, even just in the few years we've been working together, a streamlining in the way that people are being referred and connected to services, and especially in how organizations communicate with one another, already starting to reduce some of that duplication and that competition for resources. We have a community organizer who's been helping us to push toward authentic community engagement in Morristown, and we've been looking how we can incorporate that more fully into our next iteration of our needs assessment. And we've been able to focus the efforts of existing organizations to those people and places that are most impacted by poor health outcomes. And I think that's really been the biggest key. And we know it'll take years to move the bar on some of the chronic health conditions affecting our communities, but we have a wonderful partnership and a wonderful network of people who I truly believe are in it for the long haul. So for the NJHC, the collective impact change process is a long, winding road to systems change. But this image and the work that we've done so far really highlights, for me at least, that the end result is worth it and change is possible, despite the pitfalls that we might encounter along the way. So I hope it inspires you as well, and I hope today's webinar helped you to move one step closer to achieving the goals on your horizon, whatever they may be.
Yeah, great. Thank you so much, Ashley. This has been really wonderful. We really appreciate you sharing the North Jersey Health Collaborative story. I just want everybody to know that Ashley and I are very welcome. We really welcome networking, and our contact information is found here. And now we have plenty of time for question and answers, and there have been many that have come in. We have a huge audience here, so I'm going to turn it over to Erica for the Q&A and wrap up.
Thanks, Toni, and thank you, Ashley, for that wonderful presentation about how your collaboration has really mastered collective impact to create change for your community. And we do have a number of questions that have come in. I want to start with one that came out of Montana, and our participant wants to know how do you get the right people at the table? How can she be sure to do that?
That's a big question and something that we talk about a lot. And I think a couple tangible things that I might suggest. So the first is really relying on those relationships that you already have first. So some of the groups I work with really want to try to jump out and immediately go to those unlikely partners, because we talk about them a lot in this work. We say you got to get out and get outside of your bubble and reach out to others. But sometimes we skip the step of realizing that the folks we already have connections with also have connections with other people. So a big piece can really be helping to give those folks that we have those relationships with a way to clearly communicate the need and the message for recruiting others. So really relying on letting them kind of spread the word and snowballing that out to other partners. And you'll be surprised how those connections kind of web out pretty quickly within a community. I also think another key there is defining the benefit for the groups that you want to join. So it might make intuitive sense to you why you should be a part of your collaborative. It might just feel like it's the right thing to do and pretty logical, but for others it might be really about needing to define that benefit. It might be defining it in terms of finances and connections or resources or whatever that is, but being clear what your group offers to others. And the last thing I'll just say is that it takes time, and it's okay that it takes time. This is the part that we always underestimate in our group, how long it's going to take to bring in others and get them understanding and involved and on the same page. It takes a lot of time, and sometimes groups are really waiting to see the impact before they join, and that's just the way it is. And so keep working and keep showing that impact, and that alone is a way that people will come in over time, though maybe not right at the beginning.
Yeah, I think those are great answers too. And that was a great question too. Another question, actually with a few people that asked this question, Ashley, collective impact is one of the models that requires cross-sector work. And we at County Health Rankings and Roadmaps always, we promote that too, because that's where you're going to be able to see people really address health, because health is the sum of many parts. But this person, several people actually want to know, how do you create like this common, you're talking about a common agenda. How do you actually do that when you have so many sectors that are sitting at the table? Great questions.
Yeah, so I think a kind of a practical thing there too is that we've learned that people have an easier time reacting to something. So what I might suggest for this is kind of doing some type of broad kind of listening first to the community residents, to other organizations, just broadly about what the issue is that's at hand, to get kind of a broad perspective. But when it comes down to actually sit down and start drafting that common agenda, bring together a core team. So those are the folks that have been working with you, throughout. And that team should be diverse, that team, in terms of their own organization or sector, their own demographics or perspectives. But have that group kind of draft something from that broad kind of questions of the community and make a draft. And then that's what you can actually take then to go back for wider feedback and reaction. So that's where we've really been able to see folks kind of really giving solid input and knowing what they're giving input in. Sometimes it's hard to react to, hey everybody, what should our common agenda be? But if we have, okay, we listened to some folks about the issue, here's what this core team put together, what do you think about it? So what makes sense for you from this agenda? What's missing? What would you change? What would you add? And when you have that time to react and people can see it and tailor it and kind of move through it, that it makes it a lot easier for them to move to action.
That makes sense. Thank you so much. So now I want to move to a question about the backbone. One person wants to know, how much staffing and funding does the backbone have? And I don't know if he means for your particular collaboration or just in general what the expectation would be. So maybe you can kind of address both.
Okay, sure. So for our collaborative, most of so the backbone, like I said, is spread out through multiple people from multiple organizations. We have one staff person who's working part-time, who really supports kind of keeping everything cohesive and kind of holds some of those backbone functions, especially in terms of helping to communicate and making sure folks are on the same page and really give out clear and concise messages from one kind of source. But all of the other kind of backbone functions are really given by organizations in time based on their strengths. So for example, with the data committee, that's a really important backbone function that we have, is that we can provide kind of this technical assistance to our work groups, that we can engage in some primary data collection, and we can analyze existing data and bring it together. And that's really made up of folks who are volunteering or who it's part of their job, and they're the data folks who want to do that work and who are contributing, and that's the way that they give to the backbone. We also have in our backbone structure elected officers that are the ones who are elected from each of those county committees. So they're really the ones who their peers see as strong leaders and who have some of those skills to be able to contribute. Some of the other models I've looked at, some backbone organizations or backbone function is done through one organization. So they might have an organization that has maybe 3 staff people whose time is dedicated specifically to leading that, and that's their contribution to the larger collaborative. Some other organizations might have 1 or 2 different organizations working together kind of in tandem as a backbone, and others really become a full-fledged organization, and if you have enough of that funding to have full-time staff just for your organization, like ours is a 501c3, we could potentially have more staff, but it's really a matter of capacity. And so right now most of our kind of financial capacity, it really goes toward kind of maintaining our website, maintaining our staff person, and to supporting the work groups.
Great, thanks, Ashley. One person wants to know, what are the steps for starting collective impact in her county when she doesn't really have partners that are already, well, the organizations are not really partnering, and it's kind of difficult to get the organizations to play quote unquote nice in their community. And I'm just wondering from you, I'm wondering if that particular group may not be ready for collective impact now. What would you say, and what kind of guidance would you give?
Yeah, I mean, I think there's some resources that you can find on the web too about kind of evaluating kind of readiness for types of this type of work. But I would say, in that case, I think it is okay to start smaller. So that might be, instead of a full-fledged kind of collective impact model, it might be just starting with really building some meaningful partnerships. So I talked a little bit about earlier in the webinar about kind of different levels of partnership even. So, it might just be in the beginning kind of sharing resources and getting that pipeline going where you're kind of sharing information. And then it can kind of build from there. So getting to know one another and maybe some joint referrals. So there are steps that kind of you can start small, and that's okay. So really, this doesn't happen overnight. Something can't go from just a group of people to a full-fledged giant collaborative or an organization overnight. It takes years, and it's okay to start small. And so I would really recommend in that case, look for those partners who would also benefit similarly from something that you think is important for your organization. So if you're working around a certain health issue or a certain topic, starting just getting those conversations and feelers out. Look for where there's those duplications of efforts. So for example, for us, that was really around that needs assessment. It was very clear that there were many organizations, including our public health partners and our hospital partners and some of our nonprofit partners, who were doing health needs assessments. And they were putting a lot of time and energy and work into doing them. And kind of the value add that we started with was, let's do it together so that we don't all have to do it alone. Let's do it together so that we don't end up with several plans that might even be contradicting each other. So I would kind of look in your community for those places where you could kind of take care of some of that duplication of efforts, or kind of find those mutual benefits and start having conversations. And that's a fine place to start, and that can really lead to this larger model over time. But yeah, you don't have to jump right in. It's about really building your own capacity and the capacity of those partners in your community to be able to do this long term.
Yeah, absolutely right. And I want to encourage all of our listeners today to take a look at our Take Action cycle that's on our website, because a lot of this preparation that is needed for collective impact, we have tools for it in our work together action steps. So I would encourage you all to just kind of dig around in there and see if you can find some tools that might help you be able to build that broad-based partnership and build that commitment. And you can always check in and check the Get Help button and ask for a community coach to help support you in that effort. Ashley, we had a question from a listener who wants to know if have you discovered a good way that helps you really nail down the return on investment that comes out of collective impact? Do you know?
So we have folks in our collaborative who would be way more suited to answer that question than myself. So I won't get into detail or do that too much because that's not my area specifically. But one of the things we've been talking about a lot lately is valuing in-kind time. just as a place where maybe folks don't think about that as intuitively every time. So sometimes we think about it as cost savings to healthcare. That's one area that we're working on too. I am from a hospital system, so that's something that can be used to help monetize that impact. But that in-kind time is one of those things that we often overlook and don't really realize or capitalize on the value of that. And so that's a huge piece that we've been trying to look at in terms of putting a number with that and really seeing how we're doing that. Another thing is putting monetary value to specific resources that we've leveraged. So they might be resources that organizations, not just the in-kind time of a person, but for example, doing financial audits or providing the treasurer piece of the collaborative. So there's certain tools and things that come together with that. What's the monetary value if we were to buy that out? If we were to pay for that service. So for us, it's been, and like I said, I'm not the expert, but for us, it's really been kind of looking at those pieces that maybe aren't as clear cut and adding them to what we already know that we have an impact on in terms of the finances. So it's really about kind of different pieces at different levels. So the larger level, like I said, might be those cost savings to your local emergency department. But some of the things that add up a lot are those times of organizations whose staff people are spending their time going out, walking the community, talking to people and doing the actual work. And that's something that we undervalue.
Yeah, I would definitely agree with that. I do want to remind our listeners that there are two handouts in the handout box. One is a PDF of the slides from the presentation, and the other one is a PDF of all the chat links that we shared with you. So if we did have a couple of listeners wanting to know how they can access that information, they are in the handout box already for you. One listener wants to know, Ashley, what are the keys to sustaining your collective impact work?
So I think the keys, one big key is, I would say, kind of keeping momentum. So it's hard sometimes, especially during the setting the common agenda, those planning phases or those moments when you have to kind of stop to start that I talked about. People, especially folks like myself who really have a bias toward action and want to go and do, sometimes find that time a little hard. And so it's really important that we're clearly communicating kind of why we're doing what we're doing and what the intended long-term impacts or processes are going to lead us to. So I think that's a really big thing. I think the sustainability also comes from just what we're talking about today. It's demonstrating your impact. So like I said, some partners might still be waiting on the sidelines to join us, to join other groups, waiting to see kind of, is it worth it to them to put their resources toward this? And so sustaining it and building it over time is really about showing that, yeah, we can make an impact. And sometimes that impact comes in different ways, which is why when I was talking today about those multiple levels, why we want to show both process and outcomes and why we want to do it not just at the big top level. So we're not going to see, for example, childhood obesity change in, a quarter, in a year, in a couple years. So if that's the only way we're tracking our impacts and we're not talking about the process and all the other things that are coming together for this work and that are kind of prerequisites sometimes for that change, then they're going to miss that movement. So it's really kind of showing that movement over time. And honestly, too, another key and a big part for me personally has been the relationships. So as we're working together, we're not just working together because we care about the issue. We do, but we're starting more and more the longer we're together to work together because we care about one another and we care about one another's success. We're caring more as we're learning that we have these mutual goals. We're caring more about how this other organization is doing and if they're succeeding. We want them to succeed because through collective impact, our success is tied together. And it's not about those kind of conflicts or maybe grappling over grant resources or things like that. If we're getting the resources together, we don't have to do that. And so I think the relationships then become a really huge key to sustaining and to building over time.
Oh, it seems like Erica's lost sound. Yep. So Erica, are you back?
Erica did lose. Okay. Nope, this is Kate.
Okay, thanks.
Hi, everyone. I'm Kate Kunkel. I've been listening in the background as Erica's backup as she's traveling today. So I'm going to jump in and ask a few more questions until Erica maybe can rejoin us. And thanks so much, Ashley, for all the questions you've answered so far. So one of the questions, sorry, there's lots coming in here. So I guess there is, oh, go ahead.
No, go ahead.
One question, kind of just in terms of a nitty-gritty logistical one, but I know that can be really helpful for folks who are thinking about doing this work, is how often do you guys meet? Your large group, your executive committee, your work groups, what's kind of your meeting structure? I know that can be a hard thing to figure out for some groups.
Yeah, no, that is really an important question that people don't usually ask, so I appreciate that one. So for us, when we were doing our needs assessment, our county committee meetings were really meeting monthly because we were really presenting new information. The data committee was coming and sharing the data from our website in these different categories and kind of building and getting input. And that took time. Once we had that process and we were starting to work and we had our work groups, our county committee meetings happen quarterly. Our executive committee and board meetings happen around about that same amount of frequency, but then the work groups who are working on the specific issues, they're the ones who are meeting in between those meetings. So they tend to meet monthly or more than that. So really depending on where their work is and what's going on with that. And so it kind of varies based on the groups. And some folks just attend work group meetings, they're just involved at that level. Some folks are only involved in the leadership at the higher level, and others are literally in like four different committees and really working in multiple ways. So that person's time might be a little bit more than someone else who's just working in one of the work groups, but that's usually how it is, and that's how we've been doing it for the past year.
Great, thanks. Another great question. Someone shared that they were surprised to note that the faith community is one of the 3 largest sectors represented in NJHC. I know this is a group that a lot of communities are working to engage. If you could maybe talk a little bit more about their involvement in your process and in your collaborative.
Sure, yeah, and honestly, that's been one of the areas where when we talk about those kind of more unlikely or folks that might have not been at the table when we talk about health conversations in the past, that's one of those groups that we've been intentionally thinking about. And especially we found that we have a lot of success of really bringing in faith communities when we're really targeted in our geographies and populations, and that those overlap with the groups of the faith communities we're working with. So for example, in Morristown, so that geography-based work group that I mentioned early in the webinar is really Morristown United for Healthy Living. It's one of our work groups, and that group is really focused on a specific neighborhood in Morristown where we saw greater health disparities. And we've been really successful in engaging the faith communities there because it's really tangible. It's their neighborhood. So that's really where they're working. They have been working for years and years and years to improve, the spiritual and physical health in a lot of cases of the folks that live there. And so that's been a really good way to tie people in. Other groups have had success when they're really working with specific populations. So it might be that the work group has really been working to have an impact in kind of a Haitian or Creole population, and there's specific churches or other faith communities where those folks are going and where the community leaders there are really engaged. And so we're able to connect because we're showing that we have a common interest and common goals. But it's really about, just like any others, building partnerships and kind of making the case for why we want to do this. And I would say more and more we're seeing faith communities themselves take on these issues of health, these issues of social determinants of health, like housing and economic injustice, and really becoming active. And so when we, just like any partner, show kind of that common fate and common goals, we've had some success there in bringing them in. And honestly, because a lot of faith communities have a lot of volunteer power, sometimes they become the most engaged because they have that base that's already there. They're not building it from scratch. It's already a part of what they do.
Fantastic, thanks. I think we have time for maybe 1 or 2 more questions. So another question maybe you can answer. Coalitions are dynamic. People come and go. Have you discovered any strategies to help you address partners when they sort of fall off the radar or if they aren't following through on their commitment? Have you experienced that, and any specific strategies you've been able to?
Yeah, we've definitely experienced it. Yeah, absolutely. I mean, I think that's a thing that, everybody will experience in this kind of journey, for better or for worse. And I think one of the things we've learned is really about kind of clearly defining how we want people to engage. So sometimes it's hard for folks to stay involved when they're not really clear on what they can contribute or what their impact could be in the group. So, I've definitely seen with groups that sometimes if things are too nebulous and there's not kind of a clear direction, or if it's unclear what you want from somebody, it's harder to stay engaged. We've had a lot of folks come to us and say, like, oh, wow, like I like this group because you're actually doing something now. Some of the groups I go to, we just talk about an issue, which definitely has value, but a lot of folks were waiting for that moment of doing something. And so if you're just asking them to come, but they don't know why or what the value is, they tend to drop off more quickly, I think. And I think something that we've really learned too, or at least I have recently, is there's some times where you just need to clearly ask if it's something that they can commit to and something they can do. And so not being afraid to be a little bold sometimes and asking your partners, kind of, this is what we need, is this what you're able to do? Because sometimes the answer is no, and it's better to know that earlier on. So in some of the groups, I know we've spent a lot of time kind of, I don't want to say like chasing after, but really actively pursuing certain partners that we think are key to the efforts. And it's because they have resources or they're connected or for whatever reason. But there's a lot of time that goes into just that recruitment. And sometimes that organization isn't ready, or they're not interested, or they're not there. And that's not really, necessarily our job to change their minds. It's sometimes saying, okay, not now, but we're going to do the impact. We're going to keep working on what we're doing, and we're going to come back to you when we've done some things and have another place, and keep the door open, in that case. But sometimes it's better to know earlier than later that the answer is no, not right now, I can't. And in that too is not asking organizations more than they can really give. So we know that all these different organizations and community members too, when I say organizations, I mean stakeholders, and I should be saying that, it's asking people and being clear about what they can give, but not asking too much, and making sure that every little bit is valued. And that's where that in-kind time comes in. That's where really celebrating your partners comes in. That's where really validating the work that they're doing comes in, and to make sure that they know that they're a key to this process, and that you want them there, and that you need them there, and that you can also, really give them the benefit of being a true partner in the work. And I think those things can kind of help keep people engaged over time. But as the momentum grows, and again, like I said, as those relationships grows, it's a lot harder for someone to say, I don't want to be a part of this anymore, when you've become, close in your work, and you've really tied together what you're trying to do. So the tighter you're aligning these visions, the easier it is to build that over time, I think.
Those are some great tips, Ashley. Thank you so much. I know it can be kind of a fine line to walk and a tough balance at times, but again, something that we all continue to grow in and refine as we do this kind of work. So I think we're going to wrap up. There are a couple of questions that we didn't get to. There are some data-specific questions that I think we might see if Ashley can field offline. And for the person asking about the limitations to collective impact, if you look at that handout with the chat links, there are some articles on there that kind of speak to those. I know Ashley talked about them a little bit earlier. Again, it's not that it's not a model that you shouldn't be thinking about, just thinking about what those limitations are and what works for you and your community and the work that you're trying to do.
Yeah, and I would add there being really critical in your thinking. So, it's not just, is this going to work? It's really who would this work for? Who would this benefit? So those critical questions that relate to kind of your community's structure and kind of the different things that we all face that we have to be kind of critical and sensitive to in our work.
Absolutely. So I'm going to wrap us up here. Erica, this is always why you have a backup plan. Erica was traveling today. She's on hotel Wi-Fi. We know that's not always cooperative. So Toni, if you want to move us forward, I'll wrap us up. All right. So I just quickly want to acknowledge, very much like the collaborative that we just heard about. County Health Rankings and Roadmaps is also a collaborative. We have lots of different partners at the Robert Wood Johnson Foundation here in Wisconsin and across the U.S., and many partners that we're working with to do this work. So a big shout out to them and a thank you to them. I also want to mention that we have 11 community coaches on staff that are available to support the work that you're doing in your communities, whether it's answering a question or referring you to resources or really working more deeply one-on-one with folks from your community collaboratives and partnerships. Toni Lewis, who did a fantastic job of putting this webinar together today for you, is our community coach based in New Jersey, and she has sort of a special role that she is funded by the New Jersey Health Institute. So she really works specifically in New Jersey. It's a unique model that we have here, and one that we are excited about and has been really fantastic for the communities in New Jersey. I also want to let you know about an upcoming learning opportunity. So if you want to get more involved in a discussion around this topic, around collective impact and evaluation, we will be hosting on Thursday, June 1st at 3 p.m. Eastern Time, a post-webinar discussion group. So this is a chance to dialogue with your colleagues across the nation about what you heard and learned today and about your own experience and your own questions. We know that many of you are also doing this work and want to be able to share that with others. So it's a great opportunity to network and connect with others that are on this journey, that are maybe using this model, thinking about this model, having the same challenges and maybe overcoming them. So a note that this is a conversation, it's not a webinar. We won't be giving information to you. We will really be facilitating a discussion. So it's like a panel and you're part of the panel. So come ready to talk and be part of that discussion. We want you to think about, what you want to know, what ideas you have that you want to bring, and really come ready to be engaged and talk. We will be sending out a link to to register for that, and you'll be getting an email to register for that later this week as well. And finally, there's lots of ways to stay connected to us if you aren't already. On Twitter, on Facebook, we have a newsletter. We put out lots of great information when we're able to, when we have it to share, and we hope that you find it helpful if you're connected already, and if you aren't, please follow us. And I think that's all we have for today. Thank you so much for joining us. Thanks to Toni and to Ashley and to Erica for their work on this. We hope that you enjoyed the discussion today, and we hope that you'll consider joining us for that discussion group on June 1st to bring your own questions and expertise and ideas and have an opportunity to network and connect with others. So thanks so much and have a fantastic day, and we'll look forward to connecting with you again.